Hello everyone, welcome to another edition of Cosmetic Corner. Today we're going to talk about preservation rhinoplasty. And we're very fortunate to have Dr. Dino Elyassnia with us today to discuss preservation rhinoplasty. And Dino, you recently did a live surgery of preservation rhinoplasty at Baker Gordon, is that correct?
Yeah, we did. It was great.
Excellent. Well, it's an honor to have you here. There's been a lot of recent articles in ASJ regarding this, and I thought it would be a good time to discuss some of the key pearls about preservation rhinoplasty and kind of talk about its role in aesthetic surgery. So for starters, there is some discussion that this is really a resurgence of older techniques. As we've seen in the literature, that's not necessarily the case. There's certainly some unique components about preservation rhinoplasty. Can you explain to our viewers some of those unique components about preservation rhinoplasty and what it might contribute to our practice?
Yeah, I mean, there is some misconception about the term. Preservation rhinoplasty is not just about dorsal preservation. Dorsal preservation in and of itself is an old technique that has undergone a resurgence, I think for good reason. It's a valuable technique. But overall, preservation rhinoplasty is more of a all-encompassing philosophy for all portions of the nose, the tip, the soft tissue envelope. And I think the part that's truly novel is the dissection plane and management of the ligaments and some of the anatomy that has shown us. And that has changed. That's led to a change in techniques that are new.
Awesome. Can you elaborate on some of that anatomy?
Well, I think, we always knew about Pitangay's ligament in the skull, but I think in the subperichondral plane, they're more defined, and it allows us, they're stronger in that plane and allows us to manage them, whether it's preserving them or repairing them. That is a key new element in my mind. And then also the mid-vault of the nose as well. I don't think we fully understood the shape of the mid-vault and the keystone. And in the subperichondral plane, it really shows itself and changes our approach, I think.
Excellent. Well, what are some pearls you would give someone early in practice or someone who's considering to bring this into their practice, the right candidate for preservation rhinoplasty to start with at least?
Yeah, so it depends what portions you want to integrate. You can integrate portions that involve the dorsum, the tip, the soft tissue envelope. If you're trying to integrate dorsal preservation, then you really have to choose carefully because it's not a technique that can be applied to every dorsum. Whereas if you really want to switch to an approach that preserves the soft tissue envelope, which is what I'm doing in all primary rhinoplasty, then it's a change in total philosophy. Instead of using strong tip support with septal extension grafts, we're relying on Pitangay's ligament for tip support, and we're using a closed sort of minimal access approach. So that can be applied to all primary reduction rhinoplasty, really. But that might take more, it's got more of a learning curve, and there is a way to get there that's safe, but it really depends on which portions you want to integrate.
Okay. Any other challenges someone might meet with preservation rhinoplasty as kind of adjusting to the technique?
The difficult part of the operation is first learning the dissection. It takes a while to learn the dissection. But ultimately, I think once, and so like I said, I'm using sort of very minimal access, rim incisions and a small septal incision. But initially, you can use larger access. You can make larger septal incisions. You can make the transcolumellar incision, open the nose, but still preserve Pitangay's ligament. So there's ways to modify the technique to make it easier at first and then slowly progress to less access. But the power in the operation is you spend more time doing the dissection, but it actually simplifies the operation because you're ultimately not using the grafts that we did in open structural rhinoplasty. So there's simplicity in that approach.
Excellent. I definitely saw that when I watched you do the case recently at Bicker Gordon, no doubt. Well, Dino, I really appreciate your time. It seems in summary that there's some unique components, as you mentioned, the subpericondyal plane, the preservation of anatomy, and that really if we want to incorporate into our practice, we can do it in a stepwise fashion regarding our dissection, our approach, and our selection and patient candidates. I would encourage everybody to read the new literature in ASJ regarding preservation rhinoplasty. And again, Dino, thank you so much for your time and for really distilling down the principles for us. We appreciate it.
You got it. If people wanted to learn that stepwise approach, I think there's a good chapter by Valerio Finocchi in the preservation text that discusses that I referred to.
Awesome. Excellent. Well, thank you again, Dino. We appreciate you. And everybody, we'll see you next time on Cosmetic Corner. Thank you.